dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View. Welcome to The Health View. I'm Yvonne Dunetz. Our topic today is about sports injuries, prevention, and treatment. According to the United States Centers for Disease Control, the CDC, participation in organized sports is on the rise. More than 30 million children and adolescents participate in youth sports in the United States. This increase has led to some other startling statistics about injuries among America's young athletes. High school athletes account for an estimated 2 million injuries and 500,000 doctor visits and 30,000 hospitalizations each year. Children ages 5 to 14 account for nearly 40% of all sports-related injuries treated in hospitals. On average, the rate and severity of injury increases with the child's age. Overuse injuries are responsible for nearly half of all sports injuries to middle and high school students. Although 62% of organized sports-related injuries occur during practice, 1/3 of parents do not have their children take the safety precautions at practice that they would take during a game. 20% of children ages 8 to 12 and 45% of those 13 to 14 will have arm pain during a single youth baseball season. Injuries associated with participation in sports and recreational activities account for 21% of all traumatic brain injuries among children in the United States. According to the CDC, more than half of all sports-related injuries are preventable. My guest today is Dr. Christopher Couture. Dr. Couture joined Victory Sports Medicine in 2010. He received his Bachelor of Science degree in Biomedical Engineering at the Rensselaer Polytechnic Institute in Troy, New York. He completed his medical degree at Dartmouth Medical School in Hanover, New Hampshire, and then completed both his family medicine internship at Dartmouth Family Practice in Concord, New Hampshire, and residency at the New Hampshire Dartmouth Family Practice Residency in Lebanon, New Hampshire. After completing his residency, he spent an additional year developing expertise in the field of sports medicine through a fellowship at the University of Oklahoma College of Medicine in Tulsa, Oklahoma. He serves as a team physician for the U.S. ski team and Merrimack High School. He is also an active instructor in the New Hampshire Musculoskeletal Institute's Athlete Training Residency Program. When he is not seeing patients, Dr. Couture enjoys playing tennis, participating in multi-sports races and triathlons, and skiing. Welcome. I'm delighted to have you with us.
Thanks. I'm glad to be here.
So let's talk about the most important injuries, the top 10 or more injuries that you see in your practice and are related that we see from sports.
Sure. I mean, I see injuries from head to toe. Probably one of the biggest injuries that I see in my practice, especially in the setting of youth sports, is concussions. It's a huge part of my practice, and honestly, we could probably spend many programs just talking about concussions.
What are the symptoms that present with that?
So a concussion is a brain injury, and it happens after an episode of trauma, either directly to the head or sometimes even an episode of trauma to the shoulders or somewhere else to the body. But then people present with headaches, dizziness, disorientation, confusion, fatigue. There's actually a lot of different ways that people can present, and sometimes those symptoms come on immediately after the injury, but sometimes they may come on even hours or days after the injury. So there's a broad range of ways that people, especially kids, can present with their concussions.
And the importance of them getting to a doctor after something like that happens?
Oh, it's very important. The most important thing probably is for parents and coaches to be able to recognize that that's what's going on, first of all, and then not to panic. Right. But to get them to see their own physician or to an immediate or urgent care facility or an emergency room if there's that concern that, that a concussion is happening.
So what type of impact can cause that to happen? Does it have to be a real hard impact, or it could be a more minor one?
It doesn't, and that's kind of the subtle thing about concussions. We're conditioned to think about them as happening as, you know, the
Right.
big hit that is the highlight on, you know, the sports shows on the news. But it can actually happen from a number of very small and successive impacts, and you may not even figure out that there was a one impact that put them over the edge to get the symptoms. Sometimes, and we see this a lot in football players, for example, at the beginning of a season, where they'll be starting in practice and they just keep hitting on every single play, and then they just start to not feel so well either later that day or as the days go on. So it's one of the most confusing things about concussions is that there's a variety of ways that they can present and a variety of ways that, that people can get hit.
And what types of sports will they be most common in?
It can happen in any sport, but probably most common in the things that you would think about: football, hockey, ice hockey, soccer. For girls, cheerleading is a huge one, but it can even happen in things that you wouldn't even necessarily think about, like track and field, if you trip over a hurdle and hit your head on the track.
Of course.
So, yeah.
So what are the ways we can prevent them?
Probably the biggest way to prevent them is to simply be aware of them. I think the education piece, and this is something that's really improved in the last 5 to 10 years, and some would even argue that the pendulum has kind of swung in the direction of being hyper-aware. There's not a tremendous amount that you can actually do to prevent a concussion once you're out there and competing. Making sure you're competing by the rules, respecting the referees, respecting practice, and again, being aware for any changes in neurological status as you're competing, especially if a major hit to the head has happened.
So in what ages might we see this?
In my own practice, I see it in middle schoolers and high schoolers the most, but it can happen anywhere. It can happen with kids just slipping, on the kitchen floor at home. And it can happen in work-related accidents or car accidents or that sort of thing. And I realize we're talking about sports, but the fact of the matter is any sport in which anybody is participating with
Correct.
some level of contact
Exactly.
can be a risk factor for having a concussion.
And I know sometimes even with pools, some people slip on the water,
absolutely.
boom, and
Yeah.
down. But what about the little ones as they're developing? You'll see little children
Yeah, and
fall, and some of them take a real impact to the head. What
And
can
they
we
do.
advise parents about that?
Well, again, I mean, you don't want to go too far into having a hyper-vigilant society where you wrap kids in bubble wrap and foam and don't let them do anything. But on the other hand, I think it's more important for parents to just be aware of if something has happened, to be aware of what a change in neurological status might look like for your kid. Mm-hmm. If he's acting differently than he usually does, he's an outgoing kid with a high energy level, and then all of a sudden he's more clingy or fatigued or sleeping more,
not
or just
eating.
So the younger they are, and parents know this, young kids, it can be hard for them to articulate what exactly their symptoms are. Sometimes it can be difficult to put 2 and 2 together. I just saw, take 60 seconds to tell you about this young lady that I've seen this week, who got a stick to the head playing lacrosse, but during the whole week or several weeks leading up to this, she had also been developing some problems with abdominal pain, and she ended up having an ovarian cyst. And so when she came off the field from the hit to the head,
Yes.
and she was like this and grabbing herself, they actually thought that she was having issues with her abdominal pain. She even had surgery later that week.
Really?
It took her a couple of weeks. As she was recovering from the surgery, things weren't going so well, and they said, God, you know, she should really have recovered from her surgery by now. At first they were chalking it up to the anesthetic. It wasn't until about 3 weeks after her head injury that they put 2 and 2 together and said, maybe she's had a concussion all of this time. And she did, and now she's doing a whole lot better. But it can be very, very confusing. And so vigilance, communication between parents and parent and child, child and coach, parent and coach, coach and athletic trainer. I think that's where the recognition of what can happen in a concussion, you know, happens.
So explain a concussion.
A concussion is a brain injury. A concussion is a mild brain injury, and it's a reversible brain injury, but it leads to a temporary change in function in the brain. And so, like I said, that change in function can manifest in a lot of different ways, a lot of very individualistic ways. Some people get a lot of headaches. Some people have a lot of fatigue. Some people have nausea and dizziness. Some people aren't able to think straight, and so they lose their memory or their ability to concentrate. And often it's all of the above. Sometimes there's an anxiety component to it. Mm-hmm. And one of the things I even say to people in my office is that we all have our little things. We might have a little bit of an anxious personality. We might fatigue easily, but in most of our daily life, we make up for that, and most people don't know what our little issues are. Mm-hmm. Concussions have a way of taking those little issues and magnifying them to the degree that we can't deal with them anymore. And so, you know, if somebody had a little bit of an anxious personality, you can get a concussion and really become fearful. If somebody had headaches every once in a while, a concussion can really trigger a migraine disorder. If you got motion sickness in the car, but you deal with that most of the time, a concussion can make you extremely dizzy. And so that's what concussions can do. The big thing about concussions, though, is that they're reversible.
How are they reversible?
They get better on their own.
Without any treatment?
Well, that's a whole other question. They do get better on their own without treatment. But especially since we're talking about kids, and this may be an educational thing for the audience, I think maybe people think of, concussion's going to get better in a couple of days, 7 to 10 days, and that's what we tell people, except that may not be the whole truth. There's a lot more coming out now that concussions, and especially full brain recovery in kids and adolescents, can take more like 3 to 4 weeks.
Because their brains are still developing.
Brains are still developing, and the more we learn, the more we realize of the subtle changes that happen in a brain as a result of a concussion. So even though they do get better on their own, if you're talking about something that's going to take 3 or 4 weeks, and in some people many more weeks or months, there are lots of treatment strategies that can help people. We can help them by treating the migraine component of their concussion with medications. We can help them with dealing with the dizziness component of their concussion with the right kind of physical therapy, what we call vestibular therapy. We can help them deal with the thinking or the cognitive part of their concussion by having them work with a speech therapist or working with the teachers in their school on accommodations and so forth. So there's lots of things that we can do to treat a concussion as the body is recovering from a concussion too.
And can it occur again? Is it safe for a youth or even an
it
adult
can.
to go back into a sport?
It
that
can
could cause
definitely
this?
occur again. But that's, to get to your original question about seeing a physician, I think that's the most important thing is, and actually it's the state law in New Hampshire, at least if you've come out, if you've been taken out of a high school game or a game that's under the NHIAA, the Athletic Association in New Hampshire, that they have to be cleared by a physician before they can return to sports too. So a physician can diagnose the concussion, manage the concussion, and help to institute some of the treatments that we're talking about here, and then ultimately make sure that you're completely recovered before you go back to play another to return to sports.
So in the return of the sports, though, is there anything that the coaches need to do or preventive things that can take place?
I think youth sports coaches in particular, and they are much more aware than they were 10 years ago just about the concussion issue itself. Good communication between the physician and the coach, with a note that says, this kid is recovering from a concussion, he can maybe do practice but non-contact, and we're building up his athletic tolerance until we fully clear him. And coaches are generally receptive to that. They have to be. But I think that's where the role of coaches is just to understand that the recovery from a concussion is progressive, and that there are stages to it before somebody is fully cleared to return.
And how about from a teacher's point of view in the classroom related to that student going back? Are there things that they should know?
Oh, absolutely, and a lot of them do. A lot of the schools around here actually are very receptive when I send a note saying this child needs to be working, for example, in an individual environment out of the noise of the classroom, or needs extended deadlines on their assignments, or needs a period of time away from formal testing. Again, it's a lot about communication. A good and qualified physician will at least be able to make suggestions to a school, and that includes the teachers, guidance counselors, special ed coordinators, should be advocates for the kids so that the kid can continue to access the school, access the curriculum, but in a way that's not going to be overwhelming to them, that's going to allow them to actually continue their recovery instead of piling on more and more as they're trying to recover academically too.
Because that will cause them stress, and that will make it more difficult for them to recover.
Yeah, that's probably one of the biggest issues that I see in concussion recovery is getting middle schoolers, young kids, middle schoolers, and high schoolers back into school and being able to foster that communication so that they can go to school, but so that the school meets them where they're at. It's very counterproductive for a kid to just be sitting at home doing nothing. We tell kids to rest for about 24 to 48 hours after you've had a concussion, but beyond that, it doesn't do any good to be sitting at home in a dark room. You need to actually be out and engaging in your recovery. But at the same time, you're not necessarily going to be ready to take on everything that you normally take on at school. And that's where there does have to be this communication piece so that the school meets the kid where the kid is at to facilitate their recovery rather than hinder it.
And what can the parent do to help with that?
Well, the parent has to negotiate all of that. The parent has to, like we said first, recognize what the child is going through, get them to a physician, coordinate the communication between the physician and the school, advocate for their child and say, you know what, these are the specific ways in which my child is suffering from their concussion, and so these are the things that we need to work around. A good parent is going to be the best advocate for their child and help to, bridge the gaps between where the child is and where the teacher is and that sort of a thing.
And it helps that the parent has good communication with the doctor so that you work as a team to advocate for that child.
Absolutely. And I think the hardest thing for parents is you don't want to see your child suffer.
No.
For a lot of parents, and it's their first experience in going through a concussion, it can be very, very scary. And so one of the things I try to do is actually be really reassuring. I try not to be flip about it, but if a kid comes in and the parent's like, gosh, he hasn't gotten better in 3 weeks, I try to be very reassuring at that point and say, I don't even break a sweat until they've had symptoms for a lot longer than this. And then I try to say, but this is where we need to actually put our efforts, and we can be proactive about treating, and then if the parents are reassured, then they can then be a better advocate for their kids too, and take it from there.
And in taking it from there, I would think that parents and the student, after going through something as traumatic as that, they must reevaluate if that should be a sport that they participate in. Yes,
that's a question in the setting of every concussion recovery. And this gets at a whole lot of other questions. Is there a magic number of concussions that somebody can sustain before their risk hits an unacceptable level? The answer to that is no, and we evaluate everybody very individually. It is an ongoing conversation. For a kid who's had their first concussion, had symptoms for a week but then bounced right back and they're good to go at school. That's a very different discussion than somebody who's had their fourth concussion. Each concussion that they're having, their symptoms last longer and longer. They've now had their symptoms for 3 months with this concussion and they finally recover. Most of them, reach the conclusion that, yeah, maybe football or soccer or whatever was the trigger for this isn't the best thing to do, or maybe we rest for a year from that sport and reevaluate as you're getting older. So again, it's an individualized discussion, and I have that with every family as they're going through it and as they recover and we're talking about their return to activity.
Interesting, when a youth has gone through a concussion, is there any scientific data that helps us to realize that as they get older and become adults and as they age, that concussion could have a bearing on their health and well-being?
Yeah, that's really hard to say.
Because I know in professional sports like football, they are seeing some repercussions related to... Potentially.
There's a lot of noise out there around that issue, particularly with professional athletes. And you hear about CTE, which is chronic traumatic encephalopathy.
Yes.
And we're very careful about, at this point, we haven't established causation between concussions and somebody developing CTE. So to get to your question, I can't look at somebody's individual concussion and then say, 30 years from now, you're at risk for early Alzheimer's, or 30 years from now, you may have a migraine problem that may be traceable back to this concussion. That's very, very hard to do. But what we do know is that when you've had a concussion, when you have subsequent concussions, it does lower your threshold for experiencing symptoms in the future. And part of recovery is allowing that threshold to come back to where it was before the injury happened. The individual variation comes in, well, will that threshold ever get back to where it was before? How quickly does it get back to where it was before? And that's where, we know that having had concussions and having had multiple concussions does affect your risk as you go down the line. Just can't say that very, very specifically or put a number on it. We can just say it in general terms.
And does a sports medicine specialist work with the pediatrician, or does the pediatrician yield to you to take care of this problem?
I would say yes. I think the answer to both of those is yes. As a sports medicine physician, I am a specialist. Like you said, my background is in family practice, so I have a primary care background and I understand what it is to be a primary care doctor, but I have this additional training in sports medicine. So pediatricians do refer to me. Actually, as the concussion issue has become more of one over the last 5 to 10 years, pediatricians in general are, I think a lot of them are getting better at managing concussions themselves. But then if they feel like they need an extra level of care, they'll refer them to me. But then at the same time, when they refer them to me, they are to a certain extent yielding their care to me. But I always, whether it's concussions or anything else that I see a patient for, it's important that we're communicating and working together. They're relying on my specific expertise, but I rely on the fact that the pediatrician has maybe known this kid since he was a baby. And so it's definitely a team approach.
Really needs to be.
Yeah, absolutely.
With the parent right there and the child right there.
Yeah, it's critical.
Okay.
Yeah.
And as that child becomes an adult, it's important for the child to know their own medical history so that they can share with the other interns or whatever
absolutely.
doctors
And
they
a
have
lot
in the
of these
future.
kids do know it very well.
Good.
They can, they can tell you the 4 or 5 concussions that they've had and the story behind each one of them. So, and I try to educate them to know that so that they can pass that information on to the next person if the time comes.
Okay.
Yeah.
What other important area of the next type? You said concussions first, then what would be the next?
Well, you mentioned overuse injuries.
Yes.
And overuse injuries can affect anywhere in the body with kids, from wrist, shoulder, knee, ankle, hip. Growing kids are definitely at risk for overuse injuries.
Explain overuse so people understand, please.
When you participate in sports, when you have a workout,
Yes.
You need a time to recover from that. When you're training, you need to recover. That's how we get stronger. And And so overuse injuries happen when you've applied too much stress beyond the body's ability to recover. And that can happen in a lot of different ways. The volume that you're training, the intensity that you're training, a new skill that you're learning. But then, like I said, you apply too much stress and then that body part gets hurt. And so that is a real risk with kids for a number of reasons, because of the amount of time they're spending on the field, lack of recovery, and the intensity with which they're participating.
You know, when you think of children's schedules nowadays, even adults, they're so full.
It's insane.
They're probably not getting enough sleep. They might not be getting enough nutrients into them and eating properly and having that downtime to allow the body to recoup. So they're constantly pushing. What have you seen?
You're exactly right. The sleep issue is a huge thing. I could tell you about a study of dancers that documented that a lot of that, and I wish I could get into the specifics, but the gist of it was a large percentage of high-level dancers that were in middle school and high school age were getting less than 6 to 7 hours of sleep a night, and in that group they had a much more significant injury risk. So sleep plays a huge part. Just the amount of hours that they're spending in their activity. There are general guidelines that a kid should not be participating in an intense sport for as many hours per week as their age. So a 12-year-old kid should not be dancing more than 12 hours a week as a general guideline. But we see a lot of high-level dancers that are doing 16, 20, 24 hours a week.
Right.
It's not to say that they cannot, it's a general guideline, but you have to be aware that if your 12-year-old is dancing 20 hours a week, they're more at risk for having an overuse injury, for having burnout, that sort of thing, and that is a huge injury, huge issue in youth sports.
So what can be done about that? How can people be proactive and advocate?
Yeah. Again, a lot of this is about awareness. There's a lot of systems level things that have to be done, societal level things that have to be done.
Like what?
We have a huge culture of that places an overemphasis on elite athletic development at the expense of sports and physical education and participation for fun. And so parents have to be aware of that. Parents have to be aware of their kids' risk for burnout and overuse injuries. And there's like I said, there's a whole lot of societal things that go into it. There's a whole lot of parent recognition things that go into it. And the fact of the matter is, a lot of these kids want to be dancing or doing gymnastics or playing soccer 20 hours a week, but they also have to understand that, okay, you're doing that much. This is what could happen to you as time goes on.
What should parents look for?
Parents should look for, again, that their kids are not acting the way that they used to. You're talking about burnout. Are they as motivated to participate as they used to be? Is it still fun for them? Is their technique or their game off? Are they not throwing as hard as they used to? Are they obviously limping or have poor technique in their dance or in their gymnastics or that sort of thing?
Are they not sleeping well?
Are they
getting
not
enough
sleeping
time
well?
and sleep? Because
Yeah.
it's not only about the sports, it's about learning in school and doing their homework
Absolutely.
and keeping up with that.
Absolutely.
And what about, I know that there are parents that they really want their children to participate in the sport.
Yeah.
Now that's
Unfortunately,
another issue.
Yeah, it is another issue.
So what do we say, what would you recommend for the parents to really hear about that?
Probably a couple of things. I think some parents do live vicariously through their kids, and so to avoid doing that is very important. A small percentage of kids are going to go on to become pro athletes, and to have realistic expectations for your own child is appropriate. Realizing that for most people, what you're really trying to do is participate in sports for fun, but also participate in sports to develop lifestyle habits that will take you through a lifetime. It's much more important to be able to continue to ski and play tennis into your 60s than to burn out on those things in your teens because you overdid it due to unrealistic expectations of making it to the Olympics.
Now, interesting enough, what about scholarships?
Oh, that plays a huge. That does also play a huge
Yes.
part in this. You know, my kid's going to get a scholarship. This is how we're going to pay for college.
Right. So that puts pressure on.
It puts pressure on the parents. It puts pressure on the kids.
And so what can we do about that to build awareness to help? Because that could severely impact a child as they become adult related to their own health and wellness.
It absolutely does. I mean, you don't want to shut the door on opportunities that are realistic for kids, but I come back to that word, realistic. You know, are you pushing your kid beyond their capabilities because you're trying to achieve a level, whether it's a college scholarship or Olympics or nationals, that they may not be able to attain? It's a bit of a balancing act, because you do have to strive to reach higher level goals, but if you overstrive and overtrain, then you risk all of these other problems of injury and burnout and that sort of thing. So it is very much a delicate balance, and I think probably the biggest thing is make sure your communication with your kid, with your child, is open and honest, that you are that you're working for a common goal, and that you understand what the risks and benefits are as you're trying to get to that goal.
And that common goal?
If it's a college scholarship, if it's making, you know, a national team, or I just want to play sports so I can have fun with my friends. You know, the parent is the first one who should know what the kid's goals are, and don't make your goals your kid's goals.
That's an important distinction.
Yeah.
Because that sometimes gets muddled, doesn't it?
It absolutely does.
Do you see a number of students that can admit to you that perhaps the fun of the game is gone because of the pressure?
Yes.
And are you able to help them advocate with their parents? Do they feel like they're stuck playing a sport and not able to get out and say, I don't want to do this anymore?
I hope I can. I mean, you know, one of the things, you know, that we started our conversation before we even, you know, started taping about, my practice is a lot about talking. It's a lot about education. I like to be able to spend some time with my, you know, with my patients and their families about these things. So if in the room, in the exam room, I can get a sense from the child that something like that is happening, then you have to name it. You have to put your finger on it, and you have to talk it out. And hopefully you can at least start that conversation so that when the family does go home from the office, they can continue it.
So how would you recommend to a student, to a young athlete, to begin the dialogue that they need to express what's really going on and how they're feeling with their parents?
Isn't that hard? Because, you know, you don't know what the child's self-esteem is, what the dynamics are at home. I would think that probably the first step for a child or an adolescent is to be honest with yourself. And
there must be peer pressure also involved.
Oh, there's all kinds of pressure. There's peer pressure, there's parental pressure, there's the pressure that the athlete puts on themselves. You know, the further along you get in sports, you ask further demands of yourself, and you learn to kind of put down the, you know, or get past the obstacles and ignore the things that might be coming up as challenges. So
when you say for the athlete to be honest with themselves, explain that further. What are the questions to ask of yourself?
Are you having fun? What are your goals in sports? Do you think that it's realistic to, you know, achieve the goals that you've set out? Are your goals, or are they somebody else's goals? Are you happy when you step out onto the field? Are you doing this for your own enjoyment, or are you doing it for another tangible benefit? It may help to write those things down. It may help to, you know, talk them out even in the silence of your own room, but to say it out loud. And then once you say it out loud to yourself, it may make it easier to say it out loud to somebody else, somebody that you trust, whether that's your parent, a teacher, a doctor, and so forth. So
to begin that dialogue, it's critically important to learn at a very young age, to be honest.
It is, and I think maybe some kids also don't realize the breadth of this issue for society. You know, in other words, they're not alone. There's many kids that are going through, you know, similar things. Again, you know, sports and physical activity should be fun. It should be healthy, and it should be laying a foundation for lifetime participation. That's what that's a common goal that we should all have.
At all ages.
Exactly. If there's a group that are, you know, more talented, more athletically gifted, that are more elite, that can get other things out of life, including getting paid for playing sports, then more power to them. But you have to be honest with yourself about what your own capabilities and limitations and goals and desires are too.
And are there options out there besides the regular teams that have that pressure
Well,
versus things just for fun?
Yeah, and this was getting back to the previous issue that I said about it being a societal problem.
Yes.
Our societies and our communities definitely overvalue the high-level club sports, which a lot of kids play year-round soccer now, and they play year-round soccer because they're playing for clubs that are businesses,
Right.
that are for-profit, and so the development of adaptable, multifaceted athletes has become compromised in favor of developing highly specialized youth athletes, and we do know very, very well that that is a harmful pattern. And so, community rec leagues, there's not as much of that now. Or if you play in a community rec league, it's a stigma because you're not playing on the select club team. And so there's a stigma of playing for fun versus playing for accomplishment or playing at a higher level. And so that is kind of a societal thing, redirecting our priorities in terms of fun and participation, while still giving people that have the capability of playing at an elite level and want to play at elite level. That's a good thing. But we've swung so much to that side that we've really compromised the vast majority of people who need to be learning life skills from their sports and not just moving on to get their NCAA Division I scholarship.
I think you really hit it. So what would you recommend to begin to cause that shift to change?
There are actually lots of resources out there, because there literally are dozens of points that we could make on this. But there are resources out there and position statements from a number of different organizations that talk about exactly this. The International Olympic Committee has put out a position statement on recommendations of youth sports development. Many pro leagues, including the National Basketball Association in conjunction with USA Basketball, have more basketball-specific guidelines on youth sports development. The United States Tennis Association has done the same thing for tennis. U.S. Hockey has done the same thing for hockey. So there are what's the word I'm looking for? There are resources out there for specific sports. And for the societal question at large, there are also the American Orthopedic Society for Sports Medicine has put out a position statement on early sports specialization that addresses some of these more societal aspects. There is, I want to say this right, I believe it's called the Play Smart initiative from Aspen, and I'd Google it. It's out there, that talks about specific points towards society and engaging all the major players in society, from the major pro leagues right down to the individual. So there's a lot out there on this. There's a lot that can be done. We just have to engage as a society to do it.
And take the initiative to do it.
Absolutely.
Because we really want to have people have a healthy life and live it as long as they can. And,
that's the goal.
And wellness.
Right.
Right, not disease-oriented or harmed-oriented by what they're doing that they don't realize
Precisely.
is really having an effect on them. So let's, if you would, I know we covered concussion, we covered overuse, and we were covering a number of things, but other types of things that you see, and then how you can apply some of the recommendations that you would give for people as far as what they can do to prevent them.
Yeah, I mean, as a sports medicine physician, I see it all. I do see, overused shoulders, I see elbow injuries, I see wrist fractures, I see bad knees, I see sprained ankles, and that sort of thing. So, applying the principles that we talk about, it's mostly about being prepared for the activity that you are engaging in. Jumping in full bore, and I see this a lot with adults, but with kids too. They'll get into a running program where they've never run before, and then they'll go hog wild and be going great for a year, but then all of a sudden it catches up with them, and your knees will start hurting. The same sort of thing applies for kids. Be ready for the sport that you're going into. Be ready for the season that you're going into. Don't make abrupt changes.
What do you need to do to be ready? That has to do with warming up, too,
it has
right?
to do with warming up. It has to do with having a good foundation of strength and agility and flexibility and so forth. So sometimes it means putting in the time in the off season to be doing some cross training or strength training or that sort of thing, so that when you get into the more intense period of your competition season, you've got that foundation.
So you're strengthening your body and getting your body in the best place that it can be in order to adapt and be ready to take on this sport.
Right, right. Absolutely.
All right, and so you were saying you see knee injuries, shoulder injuries, ankle injuries, all these injuries from all different sports.
Absolutely, and it's hard to rank them,
That's okay, but they all apply because they cause pain and injury and affect someone's life and their ability to have a good life and be healthy and well. So overall, what would your recommendations be?
Well, you can do everything right and still get hurt. I mean, that's part of the risk that we take in participating in things. But it's better than the alternative. My mantra, if you will, is to keep people moving. Exercise is the best form of medicine that we have.
Yes.
And so having that ingrained in your lifestyle and making smart choices about just consistent application of strength, cardiovascular, sport-specific exercise across the lifetime, that's what's going to keep you healthy for the long run. That's going to keep you, from developing a lot of the diseases of Western society that we have.
Walking, even though that's not considered a sport, is still exercise. There's so many other things.
If you're out there walking 30 to 60 minutes a day, that is an incredible, benefit for your overall health. Absolutely. So again, I really, my whole mission is to keep people moving and keep people active. And so if you can do that and be smart about it and set a good foundation, then that'll set you for life. And then if you do get hurt, I'll take care of that.
All right. and the interesting thing is we can start as a family when we're young and teaching children at a very young age to get fresh air, to begin to exercise, to walk, to stretch, to have fun,
absolutely.
But also to take precautions.
It starts in primary school. And even our lack of physical education in schools has kind of led to, over time, a weak society, a physically weak society. And so, you're right, influencing people when they're young, so that they're moving, staying strong. That's not where our society is right now.
No, it's not.
Everybody, kids are inside on their electronics.
Exactly.
We don't have as much free play, so even when they are out, it's usually in an organized sport as opposed to just hanging out in the neighborhood with friends.
And so you have children who are geared to more of the sports and then others that are not. But the thing that you're saying is it doesn't matter if you're geared to formalized sports. The key is to be involved in exercise.
Right. Absolutely.
So what would you say to people about that? Being involved in exercise to be healthy and well. What are the types of things that you'd want them to do and to help their bodies?
Quite honestly, whatever's fun. Yes. Find what feeds your soul. And for some people that is just going for a walk 30 to 60 minutes a day. Some people love individual sports. That's my thing. So, distance running, cycling, triathlons, skiing. Some people really want to be involved in a team, and so, soccer and football and basketball are the thing for them. But find the thing that feeds your soul.
Hiking, biking, walking, swimming.
Set a good overall foundation of strength and fitness, and then apply that foundation to the thing that you really want to do, and then just keep doing it. And then keep trying new things too. Don't just, don't be the 12-year-old that plays soccer year-round, because quite honestly, you're more likely to make the Major League Soccer by also playing basketball in the winter and baseball in the spring as you are to playing soccer year-round.
And from a prevention point of view, things people can do.
Stay active, eat well. I mean, just be aware of what your body is capable of. Rest when you need to rest. Play when you need to play. It sounds like advice that Mom would give you, but quite honestly, that's what works. So, yeah.
Well, thank you very much. This has been very informative. We really appreciate it.
Absolutely.
Until next time.